Welcome back to our virtual Pride Week series of FAQs that we are answering on our social media channels and on our website. Today we have a question that's been submitted that has to do with PTSD. And to help us with that question is Ellen, who is one of our mental health therapists. And so here is the question. I have been diagnosed with PTSD and I have been told about EMDR. What is this approach and what's this all about?
EMDR is it stands for eye movement desensitization reprocessing. It's a nonverbal treatment for trauma. And the real basic explanation is that if you think of your brain like a filing cabinet, there's a place for everything to go. And when you've gone through trauma, that trauma gets misfiled. It's in the wrong place. So it's easily accessible by triggers. And we never know what the triggers are going to be or when they're going to happen. So with EMDR, we develop a treatment plan and we target an event. And we use nonverbal stimulation. So we use bilateral, which is eye movement, or tappers. I use buzzies so that people can hold in their hands to do this too. And they, using the treatment plan, the negative concept of self that's been associated along with the bilateral stimulation, it helps your brain process the memory through and put it away in the right place. So it doesn't alter your state. It doesn't take the memory away. It takes that emotional charge out of the event itself.
That's fascinating. And you've been conducting EMDR within your treatment plans for a while. Ellen, what is the typical length of time, or is there a typical length of time that patients need to use EMDR?
It's different for every person. And there's different kinds of EMDR. I mean, there's EMDR for pain and EMDR for obviously for trauma. There's some for addiction. And a lot of the times it depends if we can do a targeted reprocessing, which is just it's a contained processing around a specific event, or if there's full reprocessing because there's been a history of abuse or history of things that people have gone through. So I've had sometimes with just single situations, we've been able to clear out for 1 or 2 sessions. Sometimes reprocessing, full reprocessing, can take a long time, and there isn't an end date on that.
Mm-hmm. Okay, that's great information. So if people have questions about EMDR or they're interested in seeking treatment, they can contact us through our website at ucsonline.org. They can give us a call at 515-280-3860. And we'll start with an individual assessment and develop a customized treatment plan for every patient that comes to UCS, because we want to be sure it's really centered around that patient. Thank you so much, Ellen, and we'll move on to our next question. Have a great day.
Thank you. You have a good day.